Hi, welcome back to Everyday Behavior. My name is Mary Ann Shepard, and I am talking to you this month about when to seek out a referral. And so we're talking continually about referrals and early intervention in this series. And during this one, we're going to specifically be talking about some of the specific delays that you may be noticing or that you should be watching for in early childhood, and when should you seek out that referral. So the first thing that we want to look at is speech therapy. So speech therapists can provide therapy as early as 3 months of age in the outpatient setting. So you want to talk to your pediatrician in those early well child visits about any concerns that you may have with oral motor development. And so this could be their ability to swallow or suck or their nursing abilities. And so if you're really having difficulty with latch or breastfeeding problems, it could be due to an oral motor concern that could be addressed by a speech therapist that specializes in feeding therapy. So you would want to talk to your pediatrician about that. But then moving on, as you get closer to those later ages, if you're having trouble with gagging or difficulty transitioning to purees or solid foods, that could be something where you could seek a referral from a speech therapist. If they're using less than 20 words by 18 months of age, that would be concerning, and you would want to talk to your speech therapist about that. If by the time they're 2, they're not using 50 or more words, they don't respond when their name is called, or they're not following simple instructions like get your shoes, and we're not talking pick up your toys, because it's common for children not to want to pick up their toys, but things that they would want, like get your cup or your shoes or bring me your blanket. If they're not getting those things or following those simple instructions, then that would be something that you would want to speak to a speech therapist about. If their speech is difficult to understand, that would be a concern. Or if you notice that we had words and we were making progress and we met those 12-month milestones, but now we're not progressing, or we've regressed, we lost skills, that would be when you would want to speak to a speech therapist. So speech therapy is looking at a couple of things. They're looking at the child's ability to listen and understand. They're looking at their ability to use their mouth to either eat or speak. And then they're also looking at their ability to manipulate their mouth to make those nuanced sounds within their language. It is common for children to have a swallowing disorder or a speech language disorder. And the research shows that 1 in 12 children actually have the need for speech therapy or meet the criteria for a disorder. When should you seek an occupational therapy referral? So again, this can happen as early as infancy. And so you have that referral sent from your pediatrician. So you talk to your pediatrician. Things that you might want to talk to your pediatrician or that would warrant an occupational therapy referral is if they have concerns with their senses. So this is their smell, their taste, their touch, their hearing, or their vision. If they're constantly covering their ears or having a meltdown when things are loud, or clothing textures, or food textures, if they're having concerns with that sensing, any kind of sense of your 5 senses. If they have fine motor concerns, so that's those little motor muscles, those little body movements. So if they're having concerns with those little body movements, like holding a pen or a crayon, if they're having trouble with snaps or buttons or zippers, those would be a concern. So those self-help skills, putting on their shoes, putting on their clothes, taking off their clothes, brushing their teeth, that's a fine motor movement. That might need an occupational therapy referral. If they have delays in their activities of daily living, so drinking from a cup or using a fork and a spoon, that's a daily living task of a toddler. If they have difficulty with their coordination, so crossing the midline, being able to reach across their body to grab something or hand things from one side to the other of their body, or just generally uncoordinated. If they have difficulty, like we talked about, with eating, transitioning from bottle to puree or puree to solids, especially if that's a texture or a taste related issue, not necessarily an oral motor concern, but a taste or texture sensory concern. Or if you just notice that they are adamant they're not going to wear a specific type of clothing or texture, or they're always taking their clothes off, that would also warrant a referral for occupational therapy. So when should you seek a physical therapy referral? Again, as early as infancy. So if you notice that your infant only turns to one side, that's called torticollis, or if their neck is kind of tilted or cocked to one side, if they're not lifting up their head or raising their head during that tummy time, if they've got poor neck control, if they're not putting weight on their legs, and we're not talking standing up or walking, but they're not putting any weight on their legs by 6 months of age, if they're not sitting up by 8 months, crawling by 12 months, or walking by 18 months, all of these would be reasons that you would want to seek out some physical therapy referrals. If they're walking on their tiptoes, and this isn't an occasional walk on their tiptoes, but a continuous toe walk, or just frequent toe walking, you would want to seek a physical therapy referral. If you notice that they're frequently falling, or they're not walking smoothly, or their gait is just very uncoordinated, or maybe a foot is turned inward or a foot is turned outward, or something's just not looking right when they're walking, you would want to speak with a physical therapist. If they're not running smoothly, now this isn't when they first learn to run, because every child is awkward when they first learn, but they're not progressing in that smooth gait when they're running. Or after age 2 or 3, they're not pedaling that tricycle. So you really want to see them learning to ride that tricycle as they get older. So I hope that this has given you some general guidelines. You also can go to the CDC's website for their developmental milestones. That's one of our posts this month, but we talked about that in one of our previous videos, just to get a good benchmark of where your child should be. I encourage you to visit our website at everydaybehaviors.com. Please hit the subscribe button below to receive more videos or updates as we post more videos, and please follow us on Facebook for ongoing resources. Thank you and have an excellent day.